Class. Today I'm going to talk to you about federally qualified health centers. Hey, do you know of anyone that does not have insurance, have Medicare or Medicaid? Maybe they would benefit from a federally qualified health center. These clinics were originally called neighborhood clinics, were put in place to service for the purpose of serving these patients. Federally qualified health clinics are doing a wonderful job in the urban communities. I have seen the good things they have done firsthand because I have worked for them for the past almost 3 years. Federally qualified health clinics were created to service the low-income patient in its community. In my speech, I will give you information on how these clinics were started. I will give information on how they came about, what it takes to become qualified, and how they stay qualified. Federally qualified health clinics, originally known as community health centers, started back in 1965. They were created at the federal level to provide health and social services in poor and underserved communities. Through the 70s, Congress authorized separate programs for the migrant, homeless, and public housing population. By the 1980s, these clinics served more than a million patients, and by 2015, they serviced more than 24 million patients. Um, the the actual term federally qualified health clinics was coined in 1989. Legislation was calculated to address concerns. The federal grant funds that were supposed to be used to support health care for the uninsured was being used instead to subsidize treatment for Medicaid patients because Medicaid payments could not cover the cost of care. Federally qualified health care programs established cost base for federally qualified health clinics for both Medicaid and Medicare. In order for a health center to be qualified, they must meet certain requirements. They have to meet at least one of these. Receive grants under Section 330 of the Public Health Service Act, treated by the Secretary of State for the purpose of Medicare Part B as a comprehensive federally funded health care center as of January 1st, 1990, is operating as an outpatient health care program or facility of a tribe or tribal organization under the Indian Self-Determination Act as an urban Indian organization receiving funds under Title V of the Indian Healthcare Improvement Act as of October 1991. They must also meet these requirements. Um, they offer services to all persons regardless of their ability to pay, establish a sliding fee discount program, be a non-profit organization, be community-based with a majority of their governing board of directors composed of their patients, serve a medically underserved area or population, provide a comprehensive primary care service, have an ongoing quality insurance program. Um, the benefits of being a healthcare program for these clinics, they have the ability to purchase prescription or non-prescription medication for outpatients at reduced cost to the 340B drug pricing program. They have access to vaccines for children program, and they're also eligible for various other federal grants and programs um, once they become a federally qualified health clinic. Um, the the program they provide comprehensive primary care health services under to all residents in the service area, regardless of their ability to pay. These include referrals and other services necessary to access care, from case management to translation and transportation to psychiatry and social service programs. They offer different programs as far as going out to the community to provide services for people that can't get to the clinic. Um, some of the things that the federally qualified programs provide. They also have physician's assistants and nurse practitioners on board. Psychiatrists and social workers are on board. Um, just to name a few of the things that these clinics does do for the community. Like I said before, I do work for one, and I do see the things that they have done firsthand in our neighborhood. Um, Federally qualified health clinics started out as community clinics, as I said before. They were known as neighborhood clinics back in the 60s and the 70s, and they was there for the neighborhood as like volunteer doctors came in and work those clinics that for people who couldn't actually pay. The federally qualified health clinics like first started back in 1989, as I said before, and that's when they put up the qualifications for them to become a qualified health clinic. Uh, And like I said before, I think these clinics will offer a wonderful job in the community. I have seen firsthand what they have done, and I thank you.